Okay, let's go ahead and look at some of the advanced capabilities for Aura's chat. One of the things that I want to show you is the ability for Aura to take information and convert it into an infographic. So, just as a time saver, I started Aura with the question, what is the implant tray configuration for Dr. Jones? So, in the corpus of knowledge that I've loaded in, I had created a document talking about exactly how to set up an implant tray for Strawman implants. So it went through and it says, hello, Gary, I searched your knowledge vault and successfully located the implant placement tray setup guide. All right. So it's coming down here and it says, please let me know your preference so we can proceed. In the meantime, are there any other operational protocols or specific surgical guidelines you'd like me to pull from your review? And it's also talking in the sentence above, because this document contains several detailed steps and sections, would you like a condensed summary or would you prefer I guide you through it step by step? So it can generate, obviously, a text output, but check this out. If I come down here and I hit / and I scroll down and I pick infographic, this box will pop up and we can prompt it with some additional information. Maybe you want to only have it focus on something very specific within that implant protocol, or we can just let it do what it thinks is the best. So we're going to come and choose an isometric 3D, which is kind of a cool infographic. And then I click on generate, and it's going to take the response above and it is going to convert that into a really nice infographic. So think about the processes and the procedures you have within your business or practice and think about, hey, could these infographics be helpful? So one thing that comes to my mind besides obviously this could be a sterilization protocol or a sharps injury. Or do you have emergency protocols on how to deal with a patient emergency? Is that something that you could use this platform for to generate really nice graphics? 100%. Right. So I'm not going to sit here and go through this in a lot of detail, but you can see the capabilities of Aura. This should start helping you kind of create a vision of how you could utilize this within your practice or your business. So the nice thing about this is, in a lot of other platforms, when you ask it to do things like this, there's spelling mistakes, it's incorrect information, you're constantly having to reprompt it. It's just very frustrating. My experience, I've been using and testing this for months. I've never seen it really make a mistake before, which is amazing, right? If you think about these AI platforms and how they can make mistakes and hallucinate, we've spent a lot of time and energy on coding this so you don't have those types of problems. Hope you see some advantages here for your practice. All right, so I'm going to just show you a quick contract analysis. I'm trying to give you kind of the depth of the capabilities of this system. So we've loaded a lease for some office space into the Knowledge Vault, and I want to ask a question about it. So let's go ahead and do that. How much rent am I going to be paying over the next 5 years for our Brentwood office? All right, so it's going to go through the Knowledge Vault, try and find maybe a document related to a lease. But notice I didn't say lease specifically. So we're going to actually see if it's smart enough to realize, hey, Gary's asking me a question about a lease. All right, so it's analyzing the data. And here we go. Look at that. How amazing is that? It's going to break it down year by year. So you're looking at, hey, this is how much I'm spending at year 1, year 2, 3, 4, 5. It actually was smart enough to say, oh, I saw in the lease that your lease increases with a 5% annual escalation, and it did that calculation for you automatically. So, that's some of the capabilities of its, quote unquote brain and deep analysis of these documents. You can even ask it things like, hey, I don't think we're going to open up this office. I know we signed the contract, but is there any out clause or any way I can get out of this contract? And it's going to go do a deep analysis of that and review it and maybe give you some options in terms of how to get out of that contract. All right. I am going to show you what I think is one of the coolest things I have ever built in my tech career. This is the ability to interact with AI as if they're a person. I'm just going to say it. That's just kind of how I feel in terms of where we are right now with this. This has so many capabilities and possibilities. It's almost endless what you can do with this. So I'm going to give you a couple of examples of what I believe can be really helpful for a business or a practice. So what I'm going to do is I'm going to come into the live stream and I'm going to choose voice uplink. Hi, Aura.
Hi, Guy. Always a pleasure. How can I assist you?
Hey, can you do some role playing with me today?
I'd be happy to, Gary. What kind of scenario did you have in mind? Just let me know what roles we should play and what the situation is. Then we can begin the role play. And please inform me when you'd like to end the role play so that I know to exit mode. What's the scenario?
We have an employee that is always showing up late and she's impacting patient care and she's bringing the team down. Can you assume the role of that employee and I'll be the employer?
Okay, Gary, let's begin the role play. Please instruct me when you'd like to end it. Hey, Gary, sorry I'm a bit behind again. Traffic was just crazy on the highway. There's nothing I could do about it.
All right, so listen, we need to have a little conversation about this. In the last 2 weeks, we've had to cancel 20 surgical appointments because of your tardiness. We only have two surgical assistants here, and the stress that it's creating for the practice and canceling patients is a real problem.
Well, is it really that many? I mean, I try to get here, it's just hard sometimes. And the other assistant can cover, right? It's not like I'm not doing anything when I eventually roll in. I make up for it.
That's not really the issue. The issue is we're canceling patients. Some of these patients are going to see other doctors and it's impacting revenue and it's giving us a bad reputation. What can we do to get you here on time?
Well, I'm doing my best, Gary. It's not like I want to be late. Maybe if the schedule wasn't so tight or something. I bring a lot to this practice, you know? Patients like me. Can't we just figure something out that's more flexible?
Look, honestly, that's not going to work for me. So, what I need you to do is think through this a little bit. And tomorrow, I need you to come back with an answer as to how you're going to show up on time every day.
Oh, fine. I'll think about it, I guess. But it just seems like a lot of pressure for minor stuff, you know? Okay, let's end the role play. Gary, you did a great job maintaining a clear, firm consequence for the employee's behavior, highlighting the direct impact on patient care and practice reputation. That method is effective for establishing boundaries. Would you like me to evaluate that performance, or should we move on to the next topic?
Let's do an evaluation.
Gary, I'm happy to provide an evaluation. Overall, you handled that role play with great effectiveness. Here are my thoughts. Gary, I am here to help however I can.
All right. I'm reading your thoughts. So, thank you for that. Can you create a document that I can send to this employee?
The draft is now ready for your review on screen. Would you like to discuss the next steps in progressive discipline, or is there anything else I could help you with, Gary?
Nope, you've been great. Thank you for the role playing.
You're welcome, Gary. My pleasure. Talk soon.
All right, let's look at another quick scenario, maybe something more business oriented around opening a new office. So let's see how Aura is going to interact with us. Hi.
Hi, Gary. Always a pleasure. How can I assist you today?
So we're thinking of opening a second orthodontic office in Boca Raton, Florida. We're really not sure about the demographics there and whether it'd be a profitable office. Can you give me insight on that?
That sounds like an exciting opportunity, Gary. Upon doing some live research, my data indicates that Boca Raton, Florida definitely has some favorable characteristics for an orthodontic practice. The area is experiencing population growth driven by migration, which directly fuels demand for healthcare services, including orthodontics. It's also known for having higher median income levels, and with typical profit margins between 40 and 60% for orthodontics, that combination could mean a strong potential for profitability. Of course, we'd want to consider local competition and the specific operational costs for that location, but structurally, the foundational demographics look promising. Is there any particular aspect of the market you'd like to delve deeper into, like competitor presence or maybe potential patient volume?
Yeah, let's look at competitors, patient volume, and operating costs.
Based on my online research, here's a deeper dive into those areas. Competitor presence. Boca Raton has a highly competitive orthodontic market. Several practices are already established, many leveraging advanced technology through things like AI precision and remote monitoring to stand out. Differentiation will be key, perhaps by focusing on a specific patient demographic or unique service offerings. Patient volume. Nationally, orthodontic patient numbers are at all-time highs. For a healthy, growing solo practice, a typical range is between 15 to 30 new patient exams per month. Given the population growth trends and income levels in Boca Raton, achieving that volume is plausible with the right marketing and referral strategies. Operating costs. Typical orthodontic overhead falls between 50 to 60% of revenue. You'll want a budget for specialized equipment, skilled staffing, and variable costs like materials, lab fees, which can range from $200 to $900 per case. Rent in a sought after area like Boca Raton could also be prominent. Considering these factors, would you like to discuss potential pricing strategies or explore drafting a preliminary budget? Is there anything else I could help you with?
No, thank you. All right. If you thought the voice uplink and the, interaction voice to voice was cool, check this out. So we're going to go into now what's called visual feed. This is going to activate Aura's eyes. So now Aura can not only hear you and use her voice to talk to you, but she can use her eyes to look at you and interact with you that way and provide feedback. So there's lots of different use cases for this. It could be used for potential training. So I'm going to have some surgical instruments here. I'm going to hold up to the camera and see what Aura tells us about them. You could potentially walk around your server room and have it do an assessment of your server room. Hey, is the physical security correct? Things like that. It's a part of HIPAA compliance. You can say, hey, I've got this device here. I don't even know what this is. Can you potentially tell me what it is? So let's go ahead and get started. So I'm going to click on visual feed, and then I'm going to start my interaction. Hi, Aura.
Hi, Gary. Always a pleasure. How can I assist you today?
Yes, the device that I'm holding in my hand, is this safe to connect to my network at my practice?
Well, Gary, connecting your personal mobile device to the practice network can pose some risks, mostly because of potential data unsecured connections can create. Based on your company policies, there's a strong focus on protecting patient records, and unauthorized connections can compromise that security. To ensure everything stays compliant with HIPAA and your practice protocols, it's best to use the secure, approved organizational network. Is there anything specific you're looking to do on the device?
No, thank you. I was doing an assessment of my surgical rooms, and this was sitting on the counter. Is this a problem?
Well, Gary, based on that DeWalt utility knife, having non medical items in a surgical room can be a problem. The standards require a very controlled environment to prevent cross contamination. Only items directly supporting patient care or sterilization should be on those counters. Anything else can introduce dust or contaminants, making it harder to maintain the sterile field and patient safety. To keep things compliant, it's best to remove that knife from surgical areas. Would
All
you
right.
like help reviewing your room setup protocols?
No, thank you. What instrument am I holding in my hand?
Based on my training, it appears to be a pair of college pliers or dental tweezers, which are commonly used to place or remove small items. Is there anything specific you need to know about it, Gary?
No, thank you. I also am not quite sure what these are.
Okay, Gary, that instrument looks like a needle holder used to grip suturing needles. Would you like to discuss best practices for sterilizing or maintaining these, Gary?
No, I think I'm good. Thank you so much.
My pleasure, Gary. Always happy to help. Speak with you soon.